be reigniting our economic engines. We're going to be taking care of our most vulnerable, which are our senior citizens and some others. We're going to be working very, very hard on our senior citizens and our nursing homes and various communities to support those that are struggling in this very difficult time. Others don't have the same kind of struggle. For example, today, Secretary Perdue, together with Ivanka Trump, launched the Farmers and Families Food Box Program, which will provide $3 billion to help small farmers. And it'll be helping farmers, ranchers, but it'll be bringing food to some of the food lines and some of the food kitchens that you've been seeing on television. And I said, why aren't we doing that? We have all of this tremendous food produced by our farmers and our ranchers. And so we're going to be buying $3 billion worth of that food. Great for everybody, our farmers, our ranchers, and the people that need great food. A key feature of our reopening plan is the largest and most ambitious testing system in the world, by far. America is now conducting close to 350,000 tests per day, an unthinkable number just a short while ago. More than anybody in the world by far, suggesting many states now have excess testing capacity to monitor for new outbreaks. Florida, many other states have so much testing, the testers are waiting for people to show up. It's great. Another essential pillar of our strategy to keep America open is the development of effective treatments and vaccines as quickly as possible. I want to see if we can do that very quickly. We're looking to, when I say quickly, we're looking to get it by the end of the year if we can, maybe before. We're doing tremendously well. From the earliest days of the pandemic, we have marshaled the genius of American scientists and researchers from all across government and the private sector, from academia, from everywhere to vanquish the virus, and tremendous strides have been made. I can tell you, I get to see it every day. Tremendous strides are being made. Scientists at the NIH began developing the first vaccine candidate on January 11th, think of that, within hours of the virus's genetic code being posted online. So January 11th, most people never even heard what was going on January 11th, and we were out there trying to develop a vaccine, not even knowing what we were up against. Then my administration cut through every piece of red tape to achieve the fastest ever by far launch of a vaccine trial for this new virus, this very vicious virus. And I want to thank all of the doctors and scientists and researchers involved, because they've never moved like this or never even close. The NIH and the HHS have also been working constantly with private industry to evaluate more than 100 potential treatments. The Food and Drug Administration has swiftly approved more than 130 therapies for active trials. That's what we have right now, 130. And another 450 are in the planning stages, and tremendous potential awaits. I think we're going to have some very interesting things to report in the not too distant future. And thank you very much to Dr. Hahn. Through a historic series of funding bills, my administration is providing roughly $10 billion to support a medical research effort without parallel. I especially want to thank Senator Steve Daines of Montana for his incredible work. He has worked so hard to secure additional funding for vaccine development. He has been right at the forefront. Today, I want to update you on the next stage of this momentous medical initiative. It's called Operation Warp Speed. That means big and it means fast. A massive scientific, industrial, and logistical endeavor unlike anything our country has seen since the Manhattan Project. You really could say that nobody's seen anything like we're doing, whether it's ventilators or testing. Nobody's seen anything like we're doing now within our country since the Second World War. Incredible. Its objective is to finish developing and then to manufacture and distribute a proven coronavirus vaccine as fast as possible. Again, we'd love to see if we could do it prior to the end of the year. We think we're going to have some very good results coming out very quickly. In addition, it will continue accelerating the development of diagnostics and breakthrough therapies. The great national project will bring together the best of American industry and innovation, the full resources of the United States government, and the excellence and precision of the United States military. We have the military totally involved. We're also working very strongly with other countries who are also have some great scientists, doctors, and we're all working very closely together, and they're viewing us as the leader, and we are the relationship with other countries on solving this problem has been incredible. To date, Operation Warp Speed has brought together all of the experts across the federal government from places like the NIH, CDC, FDA, and many other agencies. This historic partnership will now bring together the full resources of the Department of Health and Human Services with the Department of Defense, and we know what that means. That means the full power and strength of the military, and that really talking about the logistics. If we get it, when we get it, that means the logistics, getting it out so that everybody can take it. And today we're proud to announce the addition of two of the most highly respected, skilled professionals in our country, worldwide respected. Operation Warp Speed's chief scientist will be Dr. Moncef Slaoui, a world-renowned immunologist who helped create 14 new vaccines. That's a lot of our new vaccines in 10 years during his time in the private sector. One of the most respected men in the world in the production and really on the formulation of vaccines. Joining Dr. Slaoui as Chief Operating Officer will be General Gus Perna, a four-star general who currently oversees 190,000 service members, civilians, and contractors. And Doctor, thank you very much. It's great to have you on board. Really highly respected people. Thank you. These two outstanding individuals will provide more details following my remarks. In preparation for this initiative, experts throughout the government have been collaborating to evaluate roughly 100 vaccine candidates from all over the world. They have identified 14 that they believe are the most promising, and they're working to narrow that list still further. So we started off with over 100. We're down to 14, and we have some really interesting choices to be made. They're doing very well. Through Operation Warp Speed, the federal government is providing unprecedented support and resources to safely expedite the trials, moving on at record speed. While we accelerate the final phases of vaccine trials, Operation Warp Speed will be simultaneously accelerating its manufacturing process. In other words, we're getting ready so that when we get the good word that we have the vaccine, we have the formula, we have what we need, we're ready to go, as opposed to taking years to gear up. We're gearing up. It's risky, it's expensive, but we'll be saving massive amounts of time. We'll be saving years if we do this properly, and that's what we're doing. So we're gearing up on the assumption that we'll have in the near future, relatively near future, a vaccine. Typically, pharmaceutical companies wait to manufacture a vaccine until it has received all of the regulatory approvals necessary, and this can delay vaccines availability to the public as much as a year and even more than that. However, our task is so urgent that under Operation Warp Speed, the federal government will invest in manufacturing all of the top vaccine candidates before they're approved. So we're knowing exactly what we're doing before they're approved. That means they better come up with a good vaccine because we're ready to deliver it. This will eliminate any unnecessary delay and enable us to begin providing Americans with a proven vaccine the day our scientists say, we're ready, we got it. And as we work to bring critical medical production back to America, these vaccines will manufacture that we're going to be focused on and manufacturing. They're all going to be right here in the USA. Now, we're working, as I said, with other people outside, and that's fine too. We want to get to the solution. We know exactly where the other countries are, and we'll be very happy if they were able to do it. We'll help them with delivery. We'll help them with in every way we can. We have No ego when it comes to this. No ego whatsoever. Operation Warp Speed is also making the necessary preparations to distribute these life-saving treatments at scale. So we're talking about massive numbers so that millions of Americans will quickly have access to them. This includes ramping up production of supplies needed for distribution. And I have to say, we're also very, very much involved in other things other than the vaccine. If you take a look at what we're doing beyond vaccines, it's going to be very interesting, and we may talk about that in a little while. But this includes ramping up production of supplies needed for distribution, such as cold chain storage, glass vials, needles, syringes, and more. We'll have everything right on hand, ready to go. When a vaccine is ready, the U.S. government will deploy every plane, truck, and soldier required to help distribute it to the American people as quickly as possible. America is blessed to have the most brilliant, talented doctors and researchers anywhere in the world. We have the mightiest military by far in the world. Our military is completely rebuilt. Much of the equipment has been delivered. Some of it's on the way. All made right here in the USA. We took over very, very empty cupboards, I say medically. We also had empty cupboards in a military sense. Our military was in sad shape. It was depleted. We now have the strongest military the United States has ever had by far and the best equipment. And you hear that outside, that beautiful sound. Those are truckers that are with us all the way. They're protesting in favor of President Trump as opposed to against. There's hundreds of trucks out there. And that's the sign of love, not the sign of your typical protest. So I want to thank our great truckers. They like me and I like them. We're working on something together. But we have the mightiest, and they'll be helping us with this, by the way, speaking of truckers. We have the mightiest military in the long history of humankind. We have the best and most devoted workers ever to walk the face of the earth. And now we're combining all of these amazing strengths for the most aggressive vaccine project in history. There's never been a vaccine project anywhere in history like this. And I just want to make something clear. It's very important. Vaccine or no vaccine, we're back. And we're starting the process. And in many cases, they don't have vaccines. And a virus or a flu comes, and you fight through it. We haven't seen anything like this in 100 and some odd years, 1917. But you fight through it, and people sometimes, I guess, we don't know exactly yet, but it looks like they become immune, or at least for a short while and maybe for life. But you fight through it. But what we'd like to do, if we can, is the vaccine. I think we're going to be successful in doing it, and hopefully by the end of the year. Just as generations of Americans before us faced down the most difficult trials, set their sights on the highest summit, and overcame the biggest obstacles, America will meet the moment, and this moment specifically in our time, with unrivaled speed, unmatched skill, and the unyielding spirit of the American people. Our nation will come back stronger and greater than ever. We're going to have a tremendous year next year. We're going to have a really good fourth quarter. We're going to have a very interesting and productive transition quarter where Steve is there, and I'm sure our Secretary of the Treasury, I think you feel the same way, Steve. So, and thank you for your good work, really good work. And it's not finished yet, is it? I want to thank Steve Mnuchin, everybody.
President, good afternoon, everyone. It's a great honor and privilege for me to have the opportunity to serve our country and the world in this remarkable endeavor, extraordinary endeavor, helping them and supporting them do it. The Operation Warp Speed's objectives are very clear. The President has described them, and I believe they are very credible. I also believe they are extremely challenging. However, I am really confident that our team across the many governmental agencies that are involved in these efforts, the NIH, the CDC, the FDA, ASPR, and of course with the support of the Army and our partners in the private sector, will be able and will do the utmost to deliver these objectives. In fact, Mr. President, I have very recently seen early data from a clinical trial with a coronavirus vaccine. And these data made me feel even more confident that we will be able to deliver a few 100 million doses of vaccine by the end of 2020. And we will do the best we can to do that. Thank you. We will, of course, also focus on progressing and accelerating development of medicines for those who unfortunately already caught the virus, as well as optimize the diagnostic tests. This will be our focus 24/7 over the next many months.